So coming to question 27 of previous year NEET PG. So very short, small question. Which are the following is not true? Remember, it's not true. We have to find the false statement. So it's about one Willebrand disease. Okay. Like it's a theoretical question only. One Willebrand 1 is the most severe form in children. Actually, it's the wrong statement. So we have three types of one Willebrand disease: 1, 2, and 3. So what is one Willebrand factor? It is a factor produced by the liver. It helps in binding platelets with the damaged endothelium. So this binding helps to activate the platelet aggregation. So you know very well, hemostasis starts with vasoconstriction, platelet aggregation, next is platelet agglutination. So after vasoconstriction, when the damaged endothelium of the blood vessel comes in contact with one Willebrand factor, the one Willebrand factor binds to endothelium in one side and it binds to platelets on the other side, and it activates the platelets, leading to platelet aggregation. That is the normal physiology. So a deficiency of one Willebrand factor is called one Willebrand disease. We have three types. One is the most common. Okay. 3 is the most severe. One is actually mild deficiency of one Willebrand factor. 3 is severe deficiency of factor, but it is less common. So most common is one Willebrand factor. Least severe is one Willebrand factor disease type 1. The severe one is one Willebrand disease type 3. What about type 2? Type 2 is not a quantitative defect, it is a qualitative defect in one Willebrand factor. At least remember this one. So it causes mild to moderate bleeding. Severe bleeding is with one Willebrand disease 3. The 3 are having different types of inheritance. One is autosomal dominant, one is X-linked, another one is autosomal recessive. I am not telling that here. So one Willebrand disease 1 is the most severe form in children. False. It is the most common form. So the answer is which of the following is false. So this may be the answer. Anyway, read the other options. One Willebrand disease 2 is a functional defect in one Willebrand factor rather than a quantitative defect. This is the true statement. One Willebrand disease 3 is the most severe form in children. That is also true. One Willebrand disease 3 has severely low levels of one Willebrand factor. That's also true. So obviously option A has to be the answer. So in such a question, if you are stuck up and if you have time, don't leave off this question, because if you read the options carefully, you can very well see the options are contrasting with each other. They are given one Willebrand disease 1 is the most severe form in children. Option C reads one Willebrand disease 3 is the most severe form in children. So these two are contrasting options, which means one of them has to be correct, one of them has to be wrong. See option D. One Willebrand disease 3 has severely low levels of one Willebrand factor. Option 3 and option 4 go together, right? Since one Willebrand disease 3 has severely low levels of one Willebrand factor, obviously that is the most severe form. So 3 and 4 go together. So these two have more chances of being right. So option 1 is being left out. So that is the answer actually. So you should also have some thinking skills beyond your knowledge in your NEET exam. So don't get tensed in the exam. Even if the question is long, read the last line. Try to pick up every clinical clue and try to come to the answer. Some clue will lead you to the answer. Even if you are not sure of anything, read the options and try to analyze the options. Somewhere you can get the answer, right?